Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Hello, everybody. Welcome to Daily with Doc and Becca. Let's go ahead and open up that waiting room and let them in, as yes, we are a live program with a live audience. So if you would like to join us, you are more than welcome to join us by going to zoom.dailywithdoc.com. All together, zoom.dailywithdoc.com. Wednesday, Thursday, Friday from 12 to 1 p.m. Pacific, 1 to 2 Mountain, 2 to 3 Central, 3 to 4 Eastern. And if you're in another time zone, just ask your favorite web browser what time it is in your time zone when it's 12 o'clock Eastern. Pacific. My name is Becca Dukes. This program is being sponsored by dailywithdoc.com, where you will find a good foods, bad foods list, more information that is empowering and helping you find a better health journey, and a store. But here's something that's very important. If you were invited by somebody specific, you need to get back with them because they cared enough about you to share this program with you. We are a resource for an amazing community, and we want to make sure that those who are promoting the show and sharing get at least a thank you. So get back with them, tell them thank you for sharing this show with you, and they are your point of contact if you have any further questions. Now, if you're here live with us, you want to make sure that you have that chat open, as we will be doing dictation. Marilyn will be putting dictation into the chat to help you keep notes. And she just does a fantastic job. Thank you so much, Marilyn, for that. And those of you who are here live with us, also keep an eye on that profile that says smile, because that's what the rest of the world is seeing. Now, if you are out on a different platform, not here live with us, there's a way to subscribe. Make sure that you hit subscribe. Make sure that you hit those thumbs up. Give us some love or a heart. And if you have any questions, you can put it into the chat or the comments if that's available where you're at. So right now, let us know where you're joining us from, whether you're here live with us or out on the different platforms. Today's program, I'm super excited. Oh, my name is Becca Dukes. I am the Director of Student Services for the Institute of Holistic Health, where we teach about the 4 areas of health, how they're affected by nutritional deficiencies, but we do not stop there. We go into solutions, and we hit those other areas that affect our health. So if you want more information about the Institute of Holistic Health and how you too can become a certified holistic health coach. Whether you want to use it to build business or just to have the information in your back pocket, go to coach.dailywithdoc.com. Now, let's get to today's show. So I am super excited to have on with us a good friend of mine. I want you to meet Tom Dalonzo-Baker. He is a physical therapist out of Raleigh, North Carolina, and has been at it since 1989. He has an amazing wife that I just adore, 6 awesome kids, and he is absolutely a solid human. More importantly, he has created something wild. So a method that is so effective, over 15,000 clinicians around the world have learned it. Together, they've helped over 1 million people feel better, not with drugs, not with surgery, just by doing the exact opposite of what most of us are taught. See, most of us are trying to fix a pain by digging into the pain. Well, Tom flips that on its head. So he teaches you how to ignore what hurts and only focus on what's working well. Why? Because the fastest way to make something better is to go where the body already says yes. Sounds weird, I know, but personal experience, it works like crazy, and he's going to show us how to do it right here on Daily with Doc. So let me go ahead and get my buddy Tom up here. Tom, welcome to Daily with Doc. Where did you go?
I'm right here, Becca. Do you see me?
Can somebody help me spotlight him? Because I'm not finding him.
How about that?
There. All right. So now we've got you spotlighted. Now I've got me spotlighted. We are set to go. Tom, thank you so much for coming on to Daily with Doc. I am so super excited to be able to share you with the world because you have an amazing approach where, yes, nutrition is super important, but there's things that we can do at home to help ourselves outsmart pain, which is one of your websites, outsmartpain.com. So, Tom, you're a physical therapist.
I am. Yes, ma'am.
Extraordinaire.
For 7 years. Thank you.
And I am super excited to share you. So tell us a little bit about yourself, because you're also, I mean, you're not only a physical therapist, but you're the founder of a company that is just breaking rules in a good way.
Absolutely. So you can interrupt me at any time, Becca, or anybody else. I like that. I have 6 kids. I'm used to interruptions. So if you got questions in the middle, I'll either say, "Oh, that's a great question for right now," or I'll save it for later. But we're actually going to go through and show you guys this working, because it's truly is the opposite of what you know, and I'll explain it. Becca's had treatment on it, and a group of us were at the beach, and there was 10 or 12 of us all at the same time learning this. So I'll go from where I always go when I teach this. I have 400 people registered for the. What?
You have 400 people registered for your class?
Tonight. Yeah, tonight I do. The clinicians.
Oh, wow.
To learn the same thing you guys are ready to learn right now. Okay.
Oh, and so I wanted to make a little comment real quick about our experience at the beach. Every single individual experienced significant benefits.
What we did at maybe 50 minutes or something, and most of them got better in about 20. So I'm going to try to speak for you guys. So interrupt me anytime. I've got a little speech that I like to kind of give, and it starts off very simply. It's like this: is that how many of you believe the whole body's connected? Right? And you can just put yes in the chat, right? But yes or no. How many believe the whole body's connected? Right? Pretty much every seminar I ever do, people say absolutely, yes, yes, yes. And I say, okay, so if you have an arm, a right shoulder problem, or an arm that won't lift up, how many of you have gone to the other side to try to fix it? How many of you have gone down to the left leg to try to fix it? How many of you have gone to the right leg to try to fix it? But wait a second. Thought you guys said the whole body was connected. Why aren't people doing it? And it might seem, well, why would they? It's not going to work as fast. Well, when you see today that those areas oftentimes work quicker, it's going to make you reprogram the way you've been taught so that you can get out there and get either people I've taught or actually our courses so you can see it working and get help from me as far as that goes. Okay. So without further ado, let's jump right into it so that you experience it first, and that'll make you want to ask questions, right? I'm kind of like let's help people by first just going out and helping them. Then they'll be able to ask a bunch more questions. Cool. All right. So the simplicity I'm going to do, there's 3 areas of the body that we like to treat, but I'm just going to do what I call the one-step quick fix with you guys right this second. All right, so what it goes like is I want you to find, actually, Becca, seeing you did have a neck issue. Would you mind coming back onto the screen? All right, it doesn't matter where your issue is. I want you to find, and again, I don't have to, some of you say, but mine hurts when I just sit, when I do nothing. You're trying to find a motion that feels yucky, right? And another one that feels yummy. So, for example, maybe your arm doesn't lift up well, but the other side does. Okay. Becca, you said you had a neck issue. Can you rotate your head to the left or the right? Or maybe you know which direction it bugs you. And can you find it?
I found it.
Okay, which way?
The right.
Okay, going to the right. So you, gang, maybe it's twisting to the right or twisting to the left. Maybe it's lifting a leg up on one side versus the other. You don't do both things at once. You do one at a time and see which one moves more freely and is normal-ish, and the other one that doesn't feel good. If they both suck, we'll go to another area. Okay? Yes, ma'am.
So I want to make sure everybody understands this is interactive. Even though we cannot see you, yes, you better be moving, because he's got some amazing stuff to share that's going to help you right where you're at, even if you're sitting in your chair.
Yeah, absolutely. Thank you. And I'm going to want you guys, I'm going to ask you to score your motions, right? And I want them in the chat so people can say, oh my gosh, their score was really high. And by the time we get done, I want you guys to see that other people, besides just what me saying it, you're actually seeing other people getting better. Is that cool? All right. So one more time. Becca's neck hurt going to the right, but not to the left. Sorry, I'm probably opposite of you as far as that goes. Okay. You guys find a motion that bugs you. Okay. Really get into end range. Make it hurt if you can. Right. But the other side, you may say, that feels pretty good. Right. So there's lots of motion you can do. You're just testing left side versus right side. Okay. Now I'm going to ask, how many of you have one? How many of you found one so far? Some of you with back pain might have gone to the right and to the left, because some of you go, oh, but my back hurts. Can I just do in the center? What I say is go forward to the right, forward to the left. Notice we break everything up to left side, right side, right, left, right? Find something. Let me see. I got to put my glasses on and see this.
So you'll be able to see the co-hosts.
Yep, that's okay.
But we have a few people that have made it impossible for us to show everybody's camera.
No worries. Oh, gotcha. No worries. So what we're going to do now, we're going to let Becca go to the left to treat herself. I don't do that a lot with the neck. I usually go in a twist motion in the trunk, but that's okay. We're going to let her go to the left a bunch. We're going to let you guys watch this. Is that she's going to do one set of 15 to 20. You guys have found something. Let's say you went like this and you go, oh, that hurts. But this one feels great. I want you to go ahead and just do a bunch of these. Right? How much is a bunch, do we say? If you don't have to lift a leg up, you can usually do 20 of them. If you're deconditioned, maybe it's only 15. It's not trying to get a lot done. It's just get the motion in. Right? So, Becca, you go ahead and get your motion in. Okay. And again, somebody said, what if you keep going? Somebody said, what's if it's in the small of my back? Again, you're trying to find a motion that makes it worse. And the other side, that it's normal-ish feeling. There's other little subtleties that happen, but take that general part. And if it's just in the small of the back, don't worry. We're going to do 3 areas of your body, and you don't have to be in the area of injury to fix it. Right now, we're in Becca's neck trying to fix it, but not going into the injured area. I usually have 4 to 10 people lined up at the same time doing it. We don't know whether Becca's going to get better or not on the neck or not, but we'll go down into another area in a minute. All right. So you usually do 1 set. You rest for amount of time that you want to, and then you're going to go do another set. People rest 20 to 40 seconds. If it's something heavy like a leg, they might rest a little longer. And then they're going to do it again. And when you turn back, turn your whole body with it, because the neck belongs with the head or with the trunk usually. All right. So most people can do an arm raise or a twist or a leg raise. Those are the big 3 that we give, and we'll give them here in a minute. And when you find one that's really kind of yucky on one side, but feels really decent on the other side, do the good side. Because remember, if the body's all connected, why aren't we using the other areas to try to fix the injured area? Many times you'll go to 3 or 4 different clinicians, and they still all stay in the area of injury region. But if it's a shoulder, they might go to the shoulder, the arm, the neck, the ribs, the thoracic, all right, which is the mid-back. But how many of them go to the other side? How many go to the legs to fix you? So we're going to see, maybe Becca's neck will get all better by doing this. And she'll be like, Dag, I've had this for how long? And that's all I had to do. Maybe it won't, and we'll go somewhere else. All right, Becca, you got that done, right?
I was on my 3rd set.
Oh, you don't want to do 3. 2's good.
Okay.
We're easy. Now, be honest. Turn your head to the right now and tell me how it is.
Wow, that went from a 9 to maybe a 3.
Good. So thank you for, she remembers the deal, is that you want to score it before. So we use a scale of 1 to 100 and scale of 1 to 10. So Becca's score we would have given it was a 90 because she was having probably pain in it. And now she says it went to a 3, which is like a 30. Some of you are going to say, but what do I score that with? Just say that's hard. I'm going to call it an ow of a 90. That's easy. I'm not going to score that one. Okay. Some of you get, but I feel a little something. I'm not looking for that. If it's normal-ish, that's what we're going to call it as. Okay. So she went from a 90 to a 30. So what I would then say, go ahead and do 2 more sets of those. Okay. Because if she can fix herself from something so simple, why not continue to do it? The most we ever do for people, I don't care if they're chronic pain, acute pain, whether they have surgery, anything like that, we still try to only do 2 exercises. This is 1 exercise that we're doing multiple reps. And we're going to basically do it until she either says that's all better, or that got worse, or she's plateaued. If she plateaus and isn't all better, we'll go to another body area. And after you play around with the 3 body areas, the arms, the spine, and the trunk, basically, and the legs, you'll begin seeing, I do better by treating my neck with my legs. And that happens, and it stays gone longer. That's the simplicity of the basic understanding of this. All right, so she's going to finish up those, right? And I'd love to hear, again, I know some of this stuff gets delayed. If you guys, okay. People can't chat. I got you. Understood. All right, but do that on your own. Give yourself a score. Now, she was very simple, and she said, hey, it went to a 30. That's all the way you do it. It's kind of like stepping on a scale. Oh my gosh, I weigh this much. You lose weight, boom, you come back. Now,
can we do this with the scale?
Say it again.
Can we really do this with the scale? That would be fantastic.
Yeah, wouldn't that be great? All you gotta do, well, I guess, you twist a bunch, right? A whole bunch of it, make sure you lose it.
All right.
All right, so go
ahead. For 1 second. Excuse me for 1 second. I did turn on the chat temporarily so people can respond to you.
Okay, cool.
So if anybody wants to respond, if somebody is naughty, then I turn it off.
Yep, got it. Hopefully nobody will. So, Becca, the absolute, just feel what it feels like. tell us what it feels like going to the right. It was a 90, went to a 30. What is it now?
Maybe a 10.
Okay, cool.
Maybe.
Let's make this assumption now with her. She has done 2 sets of 20 reps, 3 times, 4 times, and she's plateaued. And she's still at a 10, but she'd like to know what the other parts of her body might help her do, whether it can get even better. Okay, all she's got to do now is go to the middle of her body, find a motion that feels good, find the same opposite side. Well, find the motion that feels yucky, go to the other side and see if it feels yummy. Right now, you guys are going to say, this is really simple and it's working. Why? We'll get to that. You're going to say, this is really simple. Why do I need additional help? Well, this is basic stuff. What if Becca does a really complex movement with her neck and it comes back? She's going to say, this doesn't work. No, it does work. It's being able to know. I was a math teacher before I was a PT. So I say, you learn single digit addition at one time. That's what we're teaching you. But you know what? All of a sudden you might do something that's double digit addition or triple digit addition. Well, hell, you might already be up to multiplication. But the more that we can find a motion and the more motions we can find in your body, like 1-dimensional and 2-dimensional and 3-dimensional restrictions, the longer this stuff stays gone. And you're going to notice that this changes so quickly. You're going to be like, oh, how I've had this for, some of you guys could have things for 20 years and the things will change. And the simple reason is because nobody was treating the other parts. This has been waiting and sitting there to help you. And your body naturally goes into what's good to do what's bad. All right. Again, maybe I'll get to that later. But Becca, go ahead and turn to the right again. Did you do more? Or you didn't do more, or did you do more?
I've just done the 2 sets of 15.
Okay, you just done 2. Good. So now, as simple as it goes, you'll say, all right, I'm done with that one. I want to do one more. So Becca, would you like to do a trunk motion or a leg motion?
Let's do a trunk motion.
Okay, good. Because I was going to say, because you're visible of doing that and stuff. So anybody else? I like to go, if you've got a top problem, I like to go to the bottom. However, I love to start things in the middle. Why? Because middle can fix middle and upper and lower, but so can everything else. But most of the time, every single person that comes into me, we start with a trunk twist or a side crunch and change even wrist pain, even ankle pain with this, right? So Becca, now I want you to twist as far as you can. So put your hands on your chest or your belly button. Leave them there. You're not going like this, okay? You're twisting your trunk. Let your head be comfortable where it wants to be. And now you're going to the other side. And you're going to tell me which one's tighter, and we'll give it a score.
So I had a tinge on the right-hand side, down at the hip.
Going to the right or the left?
To the right.
Okay, good. Notice. Okay, good. And that happens to be the same side she was having problems with. It won't always be. Don't assume because she had right neck rotation issues, she's going to have right trunk rotation issues, even though she does. Don't assume you guys will. Okay. Now, how did the left side feel?
No. Well, I have a pull on the right.
Okay.
But there's no pain or discomfort on the left.
Okay, so she got a pull. I don't know if it's good or bad. So rather than dealing with maybe 2 yummies or yuckies, I want to deal with some yummy. So I'm going to say to you, will you take inside crunch? That's your belly button and your bottom half of your back stay this way. You're doing a lean. I don't want to lean. Okay, that's a lumbar lean. That's a lumbar side bend. I want it in the thoracic. So I'm going to put this down just for a second. It's kind of like this. It's all in the ribs. That. One better than the other, or they both feel good?
They're the same.
Good, they're the same. That means they're both, I'm assuming, good, right? They both feel good when you say they're the same?
Yeah.
So if they're both the same, you can choose whichever one you want. We typically say, if you had to do 1,000 of them, which one would you probably choose to do? Remember, 1,000.
Probably to the
right?
to the right.
Good.
To the right.
Good. So all I'm going to have her do is do 2 sets. This is non-weight bearing, it's not lifting up a leg or anything. Try to do 20 of those again. Okay. And as she's talking, let me give you guys a little bit more clarity on this. I'm a physical therapist, right? What am I doing with nutrition and physical therapy, and how do those connect? I tell my patients, look, my job is to get your system so that everything is unkinked and unrestricted. So nutrition and what you need to flows to where it needs to go. So when you're doing, I mean, one of the big things that we'll use on people is like the core 90, right? The basic that's got the ultra body toddy and the cal toddy and omega-3. And if they've got a joint issue and pain, we might add the glucogel. And if they then need the MSM, whichever combination that they like. And let's just say, well, it's kind of hanging out there. They may be coming to me and saying, I'm still in pain. So we're going to go fix something. Now, I work the opposite way. I go to try to correct it. And then if things hit a wall and they're not correcting anymore, I'll say it looks like a nutrition thing. So it's now hitting you at 2 different angles. Again, freeing you up so you can get your nutrition in there and get the nutrition in there so that it stays where it should be and he starts healing it up. How many you done there? You on your second set?
Second set, that's number 10.
All right, we'll do 15 just for the sake of time. All right. All we're going to do now, she said that both her sides felt good. I can go check the other ones, make sure it's still feeling good. Go ahead and check the other left side bend, make sure it's still feeling good. No, not twist, left side. There you go.
Side bend, that's right.
Still feels good, right?
Still feels good.
You check your right rotation on your neck.
Feels better than the good side.
Good, excellent, good. That means things are where now. That needs to really help your neck.
So now I have a question, because this is acute. It just happened when I was lifting somebody that had fallen on the floor. Does that make a difference of what you would recommend somebody doing compared to a chronic pain?
I'll answer that question as soon as you turn to the right and tell us whether it's better, worse, or unchanged. Just your neck. That's where you're
my neck?
Yeah, your neck. I want to make your neck better. Is that better?
Yeah.
Okay, that's what I want to emphasize. She still had a little 10, which isn't much. That's 1 out of 10, basically, or a 10 out of 100, right? And
that's better than 10.
Yeah, and now it could clean that up. Okay, so her thing is this recently happened, so we call that acute, right? And a lot of times when you hear the word acute, when people say it, it oftentimes means it's severe too. It doesn't always have to be that way, right? It's acute if it's swollen or something like that. But acute can also mean, well, usually it doesn't, but it can be chronic, and it can just kind of happen just within a couple of weeks. She said it just did. We don't change what we do for anything. It's the same process that we're doing. That's the simplicity of this. So I can come out and I can show this to a huge group of people. We average just on sessions like this a 72% improvement on anybody. And people will say, like, she just had a 100% improvement, if you want to say, but will it stay gone? And that's about her skill set of understanding the process in the single-digit addition way. And then where does she want to go to either keep it away or even dig deeper? Because you said, you know, this neck thing has been a problem in the past. If it's been something that's just like, if somebody came to one of these and they just hurt themselves last week or something and they get all better, I say, don't worry about, going and get something else and taking advanced stuff with us, because you might be all good. But most of us, no, it's my left SI or right SI that's always bugging me, has for years, or I've got pain down my leg and I've had it for a year or something like that. Then you need to know the process. So you can, again, math teacher here. Most people, when they learn how to add, subtract, multiply, and divide, they can go through life and do great. If you have that skill set, you can really be great on financial stuff. We say with this, if you know, we have 4 basic core things. As you learn those and you learn how to progress yourself, you do really, really well treating yourself. Okay. So do we have other, do we have other comments in here? Okay, no, it doesn't work.
Just looking through. So
Said,
does it work on plantar fasciitis is what Nancy's asking.
so one of the biggest ones, I'm actually putting out a video here shortly on plantar fascia, because plantar fascia, if it's one-sided, is much easier to fix than if it's both-sided. But the majority of the time that I fix it, I need to do something up in the trunk, which nobody is down there doing, except sometimes chiropractors, because again, they adjust the spine. And that's how I proved it to a patient one time. They said, I got plantar fascia so bad. And I said, I want to show you that I'm going to do something not in your legs and change it. And so I very quickly just laid her down and did a manipulation. And she got up and she was like 70% better. And then I proceeded to show her this because she wasn't buying into this concept. Again, everybody buys into the concept, the whole body's connected, but we've had a pattern. When we go, if 100 patients go into a physical therapist with right knee pain, where do they expect to be treated to fix that right knee pain? In the right leg, most likely.
Right leg.
If one patient goes into 100 clinicians, well, with right knee pain, where does the clinician expect to treat? Pretty much that right knee and right leg. We are programmed as a culture, as a society, and as professionals to only stay in this region of injury. And so this is, guys, this is why this is a generational type method I had my discovery in 2001 and since taken out to a ton of people. But that's why when people go to our clinicians, they will see, wow, I've never had that be done in such a way, because we look at the other parts of the body, and anything that feels good can help change anything that feels bad anywhere. You just have to find the right place. And that's where the system comes in, because you got to be systematic and methodical to do it. Okay.
It's absolutely amazing, because whenever we had our event, well, our gathering was for something totally different, but she did this session for those of us that were there. I mean, my thumb, I could not move. I mean, it was like sharp pain when I tried to move it. Just holding my phone, which is probably what caused it. It was hard. And now?
Do you remember which one changed you the most? Was it twist or arm raise or leg raise? Do you remember which one did?
It's crazy, because I think it was the leg raise on the right side, and this is my left thumb.
Yeah.
Yeah.
So when somebody comes in with jaw pain, where do you think everybody has stayed to treat them? Neck,
in the head.
Right? Look, the first time this happened with me, it surprised the heck out of me. Right. And when I went down their leg and I made them find a leg that was that was yucky on one side, yummy on the other, some motion. And I did it. And their jaw pain for the first time in 3 months or 3 years, their mouth opened up when they haven't been able to open their mouth up in however period of time. That definitely gets their attention, and definitely gets the dentist's attention too. But you're going to look crazy initially. We haven't gotten enough people out there to be saying all this, but there's many people that are learning it more and more, and seeing that why, if you believe the whole body's connected, can you not fix, let's just say, a shoulder or a jaw by using something else? The big mistake that is currently now happening out in the professions of rehab, which is getting rid of pain, is staying in the region of injury. It is, when you've been to 1 or 2 people and they've stayed there, they've done what they're going to do. They're really good. We're really good at what we do in the regions of what we do it. So you've done good work there, but that doesn't mean that's what is causing it, pulling you down. Like if something from the leg is pulling you down like this, you're going to feel it in the neck, not the leg. Right? When you've got a right shoulder pain and something's pulling you this way, you're going to feel it in the right shoulder, not the left one. Right? Yet it's the left one that we need to go. We don't even need to go to the left one, because you're saying, do I need to go to the left? No, we just need to go to something that feels good. And now, well, first I'll ask for questions, and then I'll share one part of this of why kind of does this work. In the next question,
Well,
how long does it last?
So I'm glad that you had brought up the jaw pain, because we do have somebody on here. I'm thinking, oh, I hope she's listening. And she just put into the chat, she says, I had a bad ear infection with a lot of pain in my right ear jaw, and I chose to do arm raises on my left side. Now I can feel my ear is draining the fluid, and my range of motion with my arm raises on the right are more flexible. So that's a 2-win. That's a double win.
That's right. And I please, is it Olivia? Is that what I saw? Olivia?
Yeah.
I'm going to show it because I'll bring this back up to normal in a second. Go, bring your leg all the way out, heel on the ground, kick up as far as you can, put it back down, feel that in comparison to the other side. And you're allowed to lean back, you know, just don't try to cheat and, you know, do this because you're not really lifting anything, okay? As long as you're lifting and this is getting closer together, you're good. See which one's harder, check it out, and see what happens to that ear and stuff too. Okay, I want you guys to know that the basic stuff is so nice and not added complexities from so much other stuff.
So you're going to see which one is harder, but then you're going to work on the one that's not as hard.
Your body, if I ask you to move, right, and I don't give you, well, like if I just say, hey, go down from standing to kneeling, you're going to do it a very specific way. And let's say you just go down on your right leg first or something. I could get you back up and I say, now, will you go in the identical way that you went down on your right? And will you go to the left as you do it? Like we all have this way. You'll notice that the way we naturally do something feels good or gooder, okay? Because maybe they're both bad. We go down the other side that we're not used to doing, you'll notice it's not too good. So your body's naturally trying to help itself all the time. How? By going into what feels good, because the more you do something good, it'll fix what's bad. Our logo, our slogan is kind of, we work what works to fix what hurts. Most people are using what's broken to fix what's broken. We're going to use what works to fix what's broken. Make sense?
I love it. I mean, it's, you think about it and, you know, first it's like, well, because of the way we've been taught, well, how does that work? That's not going to work, but it does.
Okay. So
crazy.
I will get into now. People always want to know, those of you who are like to know a little bit more. All right. I just gave you the single digit edition of this stuff. Arms, trunk, legs. All right. You got 3 things you can try and do. You saw Beck, oh, I want to do twists. I want to do this. Okay, great. Next time she'll do a leg raise and maybe an arm raise. See what happens. Because right now there's so much experimentation you can do. You could be putting your sock on, right? And you go, oh, that's tight on the left, but oh, that's easy on the right. Wait, you're just going to put the sock on a whole bunch of times? Yeah. My dad had nothing to do with medicine. He wrote a book called Easy Motions for seniors, right? Because he was so taken with this, and he would show them how to put socks on, and he'd show them how to go up and down steps. I mean, so many times people say it hurts me going up or down a step, leading with my right leg, but my left leg doesn't hurt. I go, okay, do a bunch on the left side and see what happens. And if that does it, I say, do a bunch of those for a while, right? And then if it stops working, we say, go to the trunk, check something out. We go like that. So we had a hamstring, I think I was saying before you came in, we had a lady this morning with a acute hamstring tear actually, and a trunk and a step up on a trunk twist to the left and a step up on her right was what changed her the most. Okay.
Awesome. That's wonderful. Now, Leslie out on YouTube has a question. She says, what part of the body would help heal pain under the lower left molars in the mouth? My mouth has been damaged by a crown that was replaced.
Okay. If it's going to not be like where it needs to be smoothed out or flattened out, and there's not some sort of infection going on in the tooth or something, and it's truly a mechanical thing, right? In a jaw or I would say, I never know. I try and see if it changes. So for you, I'd grip down my teeth and go, yep, that hurts. Or whether you have to have something on your mouth as you bite down and go, ooh, that hurts. Then I would go try an area. And I'd bite down again and say, oh my God, that went from a 90 to a 70. Right? Don't be discouraged, because you could be, I always say, if you will, if it's in the head, go low. and then go middle and then come up to the area. All right. So if it's a leg problem, go middle, then go upper, then go leg. You'll be so blown away because it'll help reprogram you quicker. Right. You'll get into that because when I first taught this, people would just say, oh, it's the right side. I can't lift my leg on the right side. I can't on the left. And they just stay in the legs. It was too far removed from it to think that an arm would fix a leg. But when you go, wait, you're in an encased body, you're all connected. So why wouldn't, you're pulling on things. So let me share why this works. Okay. So your body is like, let's just say we're going to work on a machine and it's made of steel. We need to know the components of steel to determine how we're going to configure and reconfigure that. In the body, this took a long time for me to figure out. I'm looking for the one thing. It's tissue. You have hard tissue, which is called bone. And you have soft tissue, which could be down to organs, to vessels, to nerves, right? And then in between, you have muscles and et cetera going up through tendons, ligaments. And tissue only does, I don't know, I think I do have a towel here. Tissue can only do two things. It can lengthen and it can shorten. Even when I twist, one direction is lengthening, one direction is shortening. When you know that, when I can't lift this up, I can keep trying to lift it up, which means I'm lengthening it. I could just take my side bend away, which means I'm lengthening that tissue from my fingertips down to my toes. I could kick my leg across the body, which means I'm lengthening that side. So that's what if I'm going to want to lengthen it. But check this out. If I lift this arm up, what's it do to this side? Shortens it. If I side bend towards it, it shortens it. If I kick the leg out, it shortens it. Do you get why I have three parts of the body that we focus on? Arms, trunk, legs. Because all I'm trying to do is shorten it. And if shortening doesn't work, there's 9 tissues-ish in the body. 7 of them like to shorten. Only 2 like to lengthen. That's your sewer system, your lymphatics and your veins. So why are we starting into things why are we trying to lengthen things? Why are we trying to go into restriction? Go into ease. And the really cool thing is you don't have to remember this. All you have to do is test motion for what feels good and what doesn't feel good. And your body's basically going to do the rest. Crazy, right? Awesome. So it's tissue. Is that cool? So it's tissue that can shorten or lengthen, compress and decompress. And that's all it ever does. So with that concept, now you know, oh, look, when I'm going this way, the tissues that like to shorten, like going shortening, the tissues that like to lengthen, and it feels good. I go this way and I go, ooh, on the opposite, I don't like that anymore.
Well, and that's like when we first started turning my head to the right. I mean, it was sharp just going halfway. And now I can go all the way.
Yep.
Without any sharp pain, without any pain.
Again, you can do this. You as you advance into the understanding of it, you can take complex motions, test them on that way, and go over here and do it, or just find another area of your body that moves well into these multiple directions of motion. And as you do that, you have so fixed up that people will leave. Like we have people that go into the weight room, right? And they're used to lifting bench press, right? And they'll do dumbbells. And this can do 80 pounds. It's can only do 40. And they're ripe for injury then. Because when they put something too heavy on, they're going to actually injure themselves. But all they do, they go to the good side. And before they know it, they come in the next day, they test and they go 80, 60. Okay, I don't want to do the bad side yet. Do some more of the good. Come back the next day or 3 days or a week later. They feel equal-ish. 80 and 70 or whatever. Hey, now I can go do what I want to do. The big thing is, how long does it last? It lasts as long as until you do a complex motion that maybe that wasn't freed up yet. So the more that you can find with complex and fix.
Uh-oh, did he freeze or is that me?
He froze.
Okay. Folks, I hope you're really paying attention here because this is some incredible stuff to help relieve pain. I can cancel my chiropractor appointment for Saturday. So after taking care of my mom and lifting her and in ways that I can't do it ergonomically, I was in a lot of pain. And now there's none. It's incredible, mind blowing. And Olivia, that's fantastic. She says, I did the leg raises left side, and now I feel more drainage in my right ear, also popping and cracking, meaning the fluid is draining in there. That's fantastic. I'm so glad you were on and listening and participating, Olivia. That's fantastic. So yes, he's going to be coming back. So as soon as he gets back in, here he comes. Going to go ahead and get him back on the screen with me. And all right, Tom, go ahead, and if you could unmute.
My apologies.
Add spotlight. Hey, no worries. It happens to the best of us.
I have no clue what happened. You got hit a power cord or something, but I don't know. So what was I saying when I left?
We were talking about you had the towel, the lengthening, shortening. You were just at the end of that.
The process is the same. The complexity is what we teach you. We do 6 motions and then we tweak it. Then we give you another 6 motions and tweak it. And whether you guys know it or not, there's 7 body positions. There's 6 motions you can do in the body to cover. There's 6 motions that'll cover all motions. And there's 4 directions of motion that'll cover all directions of motion. And there's 3 tweaks on a joint that covers all progressions. Got it? Now you do permutations and stuff like that of 7 times 6 times 3. That's how many combinations there are. But when you learn them only at 6 at a time, it's pretty cool and simple, right? And the last thing I got to tell you, how long does it last? It lasts as long as it lasts until you do it again, all right? And you learn how to get more complex if needed, okay? And people always say, what do I do for homework? Well, gang, you guys just learned 3 areas of the body. Becca, I would say this. I would say, go test yourself 2 hours from now. How's it feel? Feel good? Don't worry about treating yourself. 2 hours from then, just test. Feels pretty good. Okay, wait, another 2 hours. Oh, yeah, it's getting a little stiff. Now treat. Do 1 motion until it plateaus. 2 sets of 20, 2 sets of 20, 2 sets of 20. Usually around 6 to 8 it plateaus, or it's all better. And that's homework. It's not go to do 2 to 3 times a day. You may have to 2 hours, it's back, or 1 hour, it's back. Then you'll have to treat yourself again. But as you treat different areas of the body, things stay gone longer. And that's pretty much my story.
That's awesome.
I'm sticking with.
That is absolutely fantastic. So we have some questions. Or Nancy makes a comment, says, very good information. How about hunger pains? Nancy, we do still have to eat, my dear. We do still have to eat.
I like that.
And Olivia's like, oh no, get him back. I need more knowledge. That's awesome.
You said about belly pain or hunger. Oh, can you hear me? Did I go out again? Can you hear me?
Yep, we can hear you.
We had a guy come in. He had $30,000 of workup on his belly because he had this abdominal pain in weird times. And so I'm asking him a bunch of questions. And I said, can you show me? And he laid down on the table on his back, like if he was on a bed. And if he comes up to the right, he didn't know it. It was just, he said, when I come up, it hurts like hell, right? And I said, really? I said, will you go to the left a little bit more and to the right? The left was fine. The right hurt him like crazy. And we did to the left, and that would change some of it. And he goes, are you kidding me? He goes, it's been going on for, I think it was 6 months or something. So there you go. Maybe not hunger pain. We change belly pain. But again, one day, everybody's going to be doing this to what the body wants, and it won't look as dramatic. But right now, we have a culture in a profession that is so locked into treating a region and not the whole body. That's why it looks so fabulous and so fascinating.
Yeah. Now, Olivia has another question. Do you have any advice for dizziness or vertigo?
It's a little bit, yes, you can literally just choose a body area, but some people can go like this and say, there's my vertigo. All right. So I just say, go like that. There's your vertigo. Go do an arm, a trunk, or a leg. Then check it again. It can be that simple. There are some things that there's something called an Epley maneuver, and you go down really fast, and then you go down the other way really fast, and whichever one gets where you're really sick, that's the way they like to go to. I actually go to the one that makes you feel good, and I make you flow like a river where it doesn't bug you. And then I make you flow back up the river and come up, which may be odd to some of you. People who have vertigo, they may have had that procedure done on them. And that releases it. Again, I always tell everybody, you take it and score it. You score it by doing something that bothers it, right? Then you go do something in another part of the body that doesn't, that's like, oh, okay, cool, that doesn't bother it. And you do it and see if it fixes it.
Fantastic. Now, Tom.
Yes.
Diane is asking, does this help with menstrual pain?
How about if you have back pain with menstrual stuff going on? That it typically does. It helps with ladies that are pregnant and the baby keeps positioning a certain way, or they're in back pain. A lot of times they then have to get into one of the other 7 body positions, like getting on all fours, all right, and doing something, which somehow either frees up their pelvis that has gotten out of whack, or maybe it's the baby's position. But it's actually kind of where I began. My wife, Sarah, Becca knows who she is that's kind of what I started doing. And then I had a lot of pregnant ladies come to me with the same problem with having back pain, either during or after delivery. So again, I say to you, it may for you, because it may free up the passages and the vessels. So try it and do it. We've had people with double vision, triple vision. I had a lady that had been burnt 70% of her body. And she wasn't coming to me for, I forget what, maybe she had back pain or arm pain or something like that. And she understood the concept after just 1 or 2 visits. And she goes, Tom, every morning I stretch the crap out of my burn stuff just to get 10 minutes of relief. She goes, Tom, I went into the good, like you said. So she's taking scar tissue and folding into it, shortening it. She goes, Tom, I got 2 to 3 hours of relief. I'd never had that in my life. Or maybe she said 5 or 6. I can't remember. So tissue really, really wants to shorten, all right? Wants to go where it wants to go. Sometimes it wants to lengthen, okay? But it'll tell you that. It'll say, oh, I want to go this way. Most people, when they stretch, they don't want to stretch, actually. They will do better.
It hurts.
Yeah, exactly. So if it's hurting, I can get you to touch the floor usually pretty quickly. And I'm doing trunk and arms usually to get your what looks like hamstring tightness better.
Wow. This is so fascinating. And I just want to, say hello to all of our viewers, whether you're here live with us in the Zoom or out on any of the platforms. Again, make sure that you're giving us a thumbs up, subscribe to the channels, and leave us a comment if it's possible to leave a comment. And if you have questions, folks, if you're here live with us, you can go ahead and put your question in the chat. If you're out on YouTube or Rumble or Facebook, we've got an amazing co-host team. They're keeping an eye on those chats as well to bring those questions into the show. And as Tom, we've only got 9 minutes.
Okay.
Tell us about outsmartpain.com.
Yeah. So gang, there's 2, the clinician site is Total Motion Release, right? You can see lots of stuff, but I almost have the exact same thing on outsmartpain.com, which is for general public. And it's called outsmartpain.com. And it says Outsmart Pain powered by Total Motion Release. And there are online services with me. Okay. I've done this so many times. I just recorded it. And there's from a cheap version from $47 to $147 to $347, all the way up to $997, depending on how much you want help from me. Every single one of them comes with help from me by sending me a video. You send me their form. I talk back and forth to you on video. I talk back and forth to you on text. I talk back and forth to you on audio text, and I'll call you if there's a problem. So there's like somebody's looking over your shoulder. I wanted it to be that way. I was a teacher that was flown all over the country, and we discovered that the best way to get people to understand how to apply things and learn things for themselves is the same structure in which we created our concept with. And I really want to emphasize, gang, all the stuff that you've been taking, all right, if you're new to longevity, is really what also is going to affect your inflammation, heal your joint stuff that hasn't been going on. So again, for me, with my people, oftentimes I do Core 90, Glucogel, MSM, and you can facilitate any more of that stuff if you want to comment on that, Becca. But two very, very important aspects of healing that I believe need to be put together. And that's why me as a physical therapist, I do both of them.
Well, and the Core 90, like you mentioned, the MSM Ultra, the Glucogel at 240 count bottle. I mean, folks, you're looking at getting nutritional support for the body and then incorporating what he is teaching. The nutritional support is only going to be about $200 a month, less if you go on auto ship. So in the Core 90, which we don't talk about very often, it's actually one of the Ultra Body Toddy, which is like the Beyond Tangy Tangerine in the powder form. Ultra Body Toddy is absolutely fantastic, where it also includes the Cell Shield blend, which has nutrients that help to reinforce cell growth, which I think is fantastic. And then the Cal Toddy, and these are liquid concentrates. A dose is 2 tablespoons, folks, 1 ounce. It's a little cap. So the cap on the bottle, that's 2 tablespoons. Shoot that, drink plenty of water. I mean, we need to drink water anyways, right? To stay hydrated. And then you've got your omega, which is omega-3s, so the Jojoba Omega, and that is 2-4 times a day minimum. And that's your 90 essential nutrients. There's so many different ways to be able to put that core nutrient package together. Core 90 is one of the most affordable, most complete when it comes to going concentrates rather than going with the powder, which the powder has a little more to it when it comes to having some probiotics and prebiotics. Ultra Body Toddy doesn't have that, but it does have that Cell Shield blend. The Tangy does it. So there's lots of things that you can do, folks, to be able to help yourself. Nutrition, we absolutely think that you need to have the foundation. What Tom is sharing with us today is just life-changing, especially for those that have been dealing with pain for whether it's 2 days or 20 years. There's things that you can do on your own without having to go from specialist to specialist to specialist with them saying, we can't find anything wrong. I know, I've done it. But
twice now.
What?
Twice now, the neck and the thumb.
Twice now, but going to the specialist, for years with them not being able to find what's wrong with me. And it just nutritional deficiencies. And then you were able to help me with my little stuff that I had going on that just, when you got pain, it makes it harder to enjoy life. We can make a decision to be happy and find joy in anything and everything we do, no matter how we feel. But this just makes it easier. Let's go over to Ruth Ellen with a question.
Hi there. This is awesome, Tom. I'm going to be calling you.
All
right.
Right.
We have Tweety33 over on Rumble, and Tweety would like to know, what if you have pain on both sides of your back?
Excellent. If you have some pain, let's say you go and you do an extension, you go to extension on the left side, the right side, right? Oh, they both hurt. Remember, I said there's 3 body parts, right? You can try to find one in the trunk and see if you can find a yummy in the trunk. But you got legs you could go do. You could do bent leg lifts. You could do a whole bunch. You could kick out to the side. You could do something in the arms. Straight arm or bent arm. Find something that's yummy. Do it and see if now you go, oh, that's better on both sides. All right. Or one side will get better before the other one does. But see, that's the biggest thing is people are focusing so much on the injured, even when they go to treat. And what they expect is to see you got locked into the cultural or society belief is that, hey, I got on both sides. And you're thinking you have to stay in your back. Nope. I gave you 3 body parts, arms, trunk, legs.
Perfect. Thank you so much.
Thank you, thank you, thank you. Great question. Thank you, Ruth Ellen. Now, Tom, if somebody wants to get your help, they can go to outsmartpain.com. Do you want to give out a phone number to text or call, or is that the place to start?
That's the place to start. And at the top, you'll have my personal cell phone number. If you're looking to see if there's somebody in your area, we do have clinicians on the total motion release, like releasemyhand.com, and you'll see a locator up there. All right. Those ones can be a hit and miss because I don't know whether they took just level 1, they've done level 2, but you can always email them or text them and say, are you truly treating with TMR? Or just go to Outsmart Pain and you'll have my access by just getting one of those packages.
Fantastic. Again, that is outsmartpain.com, folks. And this has been another great episode of Daily with Doc, giving you more tools to put in your toolbox to help you as an individual create a better health journey. Thank you so much to our guest today, Tom Baker Dalonzo, physical therapist extraordinaire and founder of Total Motion Release and Outsmart Pain, and just an outstanding individual and father. Congratulations on getting a new daughter-in-law recently.
Yes, thank you. Appreciate it.
That is so fantastic.
Thanks for having me too. I really enjoy doing this. So,
well, we hope to be able to possibly have you on again, because I know we've already got people asking, when's he going to be on again? So we will work on that. It took a while because you do have a very busy schedule. But folks, go to outsmartpain.com, look at those different packages, and get plugged in as you and your individual, you as an individual need. So again,
guys, there's videos of me treating people on there too, and there's more education on the website too.
Awesome. Thank you so much. We love education, and the fact that you've got those videos offering it at no additional charge. I mean, time is an investment into yourself, people. Invest in yourself. We could get our co-hosts up on the screen with us. I could not do this by myself. Well, I could, but I appreciate not having to. Absolutely. As we have our tech team, we have Sherry, who helps to get the stream all set up and keeps an eye on things, make sure that we are still streaming where we're supposed to be streaming. Thank you so much, Sherry. We have Ruth Ellen Sanchez, who is taking our video, putting it with the graphics that's then being pushed out to the different platforms. So Sherry's keeping an eye on. We have AJ, who's not with us at the moment, but he goes through and he has helped us to get on all these different platforms, helps with the wording of what is being said on the comments. So make sure that you look at the description, folks, of the show, because you're going to find a lot of information in that description, including how you can get more information about our show, about our guest, and the products that were spoken about today on the show. So check that out. So thank you, AJ. I know you're not here with us, but we couldn't do this without you. And we have Marilyn, who, if you're here live with us, you're seeing her skill that she has been definitely gifted with, that then blesses us as a whole here in the live Zoom. Thank you so much, Marilyn, for all the dictation that you put into the chat, keeping those great notes. And we have Albert, who is joining us from South Africa, letting people in, as he is our friendly bouncer, joining us. And also, you know, folks, get back with the person that shared this program with you. They cared enough about you because they don't want you to be in pain anymore. And these are some simple things. You need to get back, even if you did it and you're pain-free, get back with the person and thank them and say, hey, what can I do to help support my body maintenance-wise to keep the cells healthy? Because you absolutely, everybody, if you breathe oxygen, you need the 90 essential nutrients to be able to continue to breathe oxygen without having things that happen as you quote unquote age. Okay. We're not going to say get older, as we age, as we mature. So Tom, thank you. And we've got Teresa saying thank you also. Lots of comments coming in. I usually miss all of them as we're coming to the end of the show. Ruth Ellen, you are with your hand up again.
So Bruce on YouTube wants to know, thank you. When is Tom going to be on again? You got to come back, Tom, because this was amazing. And we've got lots of thank yous on YouTube, from Rafi, Bruce, and ZZ Captain. And I believe Olga said thank you, and Diane also said thank you.
Beautiful.
Awesome.
Beautiful.
Wanted to share that.
Yes. And thank you. Thank you again, everybody, for taking the time, joining us here live in the Zoom. Nancy is saying thank you. She's glad that she was able to make it on time. This is why we do it, folks. We want to help people feel better. That's all there is to it. For me, it's a ministry. If I can share my story to help just one more person, then that makes me happy. Thankfully, as a community, we're helping people around the world, and you can be part of that too, as we do have a program that allows you to get a thank you check for sharing the longevity products and helping yourself, your family, your community. And again, together, we're helping people around the world. So get back with the person that shared this program with you. If there's no one to thank, you've never tried the products before, you haven't worked with anybody, you were not referred to this program, you can always go to dailywithdoc.com. Oh, and everybody, sign up for the newsletter so you can stay in the loop. You can use that contact us there or send us an email, questions@dailywithdoc.com. Send us your questions, whether it's about what can be done about something that you specifically may be going through, or how you can be involved in a community that supports each other, cheers each other on, and just becomes family. You can also call 855-949-3377. Again, that's 855-949-3377. Join us tomorrow as we have pharmacist Ben Fuchs on for Pharmacist Fridays here on Denison. Certified Holistic Health Coach course offered by the Institute of Holistic Health. Till next time, bye for now. Thanks again, Tom.
Welcome. Thank you.
Bye, everybody. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the
a founding father of the science of epigenetics, guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.